Good evening. Today I will discuss the awareness of male breast cancer. As a certified coder, I recently viewed a 50-year-old man diagnosed with male breast cancer. In the record, I read that this patient was diagnosed in the last stages of his breast cancer. After discussing with the physician, he informed me that most men do not associate the signs and symptoms of breast cancer. Today, I will discuss the signs and symptoms of breast cancer, the statistics of breast cancer, and standard techniques to perform a self-breast exam. How many men in the audience perform a self-breast exam? Did you know in 2011, 2,140 men will be diagnosed with breast cancer? Out of the 2,140 men, 450 men will die from breast cancer. There are visual and non-visual signs and symptoms of breast cancer. The visual signs are skin dimpling, nipple retraction, redness and scaling of the nipple, and discharge of the nipple. The non-visual signs is a lumpy swelling, which usually but not always painless. The non-visual symptoms and signs are only detected by self-breast exam. Let's view a video on how a man will perform a breast self-exam.
Fight back against the fight against breast cancer is to perform monthly breast self-examinations. One method of performing a self-examination is standing in the shower. In a vertical position, a man raises his right hand over his head to examine his right breast. He protrudes his right breast tissue forward or outward and examines his breast using the pads of his left hand. With the first two or first three finger pads, a man examines his axillary area here, extending across the collarbone to the sternum, down below the breast, and back up to the underarm area. Pay special attention to this quadrant, the upper outer quadrant, which is where most breast tissue actually occurs. With the pads of the first three or two fingers, the man presses firmly but gently and prods or palpates the breast tissue, looking for any abnormalities such as a lump, which may be hard or soft, or areas of tenderness. The man should perform the examination using a grid fashion, with the fingers palpating or walking slowly across the breast tissue. The man can look for any abnormalities in the axillary area or down across the breast tissue. It is important to know that men do get breast cancer, and following a monthly routine to check your breast will help you become more familiar with your breast tissue and enable you to better detect a change in breast tissue that should be referred to your physician immediately.
Men, just like women, should perform self-breast exam. Early detection and awareness will decrease the statistics of men dying year by year. If you have any of the signs and symptoms, I suggest that you actually consult a doctor. And that is my presentation on the awareness of self-breast exam and male breast cancer.